Can whole exome sequencing have false results? If you are curious about the accuracy of whole exome sequencing, you are not alone. Many people wonder how reliable this genetic testing method really is. Let's break it down. Whole exome sequencing focuses on the protein coding regions of our DNA, which make up about 1 to 2% of the entire genome. While this targeted approach can provide important information, it is not without its flaws. First, let's talk about false positives. These occur when a test indicates a variant is present, but it actually is not. Technical limitations can lead to these errors. For example, sequencing errors or alignment issues can cause confusion in the results. Research shows that the false positive rate for whole exome sequencing can be significant, with some estimates around 5% or even higher. This means that some variants reported may not be clinically relevant. Now, what about false negatives? These happen when the test fails to detect a true variant. Whole exome sequencing can miss variants, especially those located in areas with poor coverage. The false negative rate for this method is higher compared to whole genome sequencing. In fact, whole exome sequencing may miss about 2 out of every 100 variants, while whole genome sequencing misses only about 2 out of every 10,000 variants. Another limitation is the types of variants whole exome sequencing can detect. It is primarily designed to identify single nucleotide variants and small insertions or deletions in coding regions. However, it is less effective at spotting larger structural variants or variants in non-coding regions, which can also play a role in hereditary health. Due to the potential for false results, it is important to confirm any variants identified by whole exome sequencing. This is often done using additional methods like Sanger sequencing, especially for variants that have clinical significance. This extra step helps reduce the risk of reporting false positives in a diagnostic context. When comparing whole exome sequencing to whole genome sequencing, the latter generally offers more comprehensive coverage and lower false positive and false negative rates. However, whole genome sequencing is typically more expensive and generates larger datasets, which may not always be necessary based on the specific health questions being addressed. For family genetic testing and hereditary health, understanding the limitations of whole exome sequencing is essential. While it is a powerful tool for identifying genetic variants linked to inherited conditions, results should be interpreted carefully. They are best considered alongside clinical findings and confirmatory testing. Choosing between whole exome sequencing and other genetic tests will depend on the specific health concerns, the types of variants suspected, and the resources available.